Good evening, everybody. It's an absolute pleasure for us to be here with you today to share with you some exceptional insights from an absolutely amazing rock star panel. You guys are in for a real treat. We're just going to quickly go over some basic guidelines before we get into it. I'm sure you guys are all pros at this, so if you are not on the panel, keep your audio on mute. I do believe we are going to have a segment for Q&A. So when we get to that point in time, think about what your questions are. I'm sure you're going to have a lot of questions. But think about what they are, write them down, etc. And then when we get to that segment, over to you, because we really want to have great engagement with everybody. And so with that, I'm also just going to remind my amazing panelists that we're going to be keeping to time. So let's try to stay on point. I know you have a whole lot of information to share with our colleagues today, but I'm going to ask you to stay on point. And so with that, thank you so much, everybody. Of course, this panel is going to be all about not just healthy aging and longevity, but specifically how can we utilize and structure global partnerships and with strategic partners and investors to really accelerate commercialization. And so with that, my name is Lisa Lamy. I'm going to be the chair for this panel. I am the managing partner for Maroon Venture Fund. Maroon Venture Fund is a US-based venture capital fund investing seed to Series A+ in, drumroll, healthy aging and longevity, specifically to advance precision medicine and preventative health for chronic health conditions. We also have an affiliated research institute, which is based out of the US, but which is global in 15 countries to advance the innovation of protocols and preventative methodologies. And so with that, I'm going to turn to Paula and ask her to do a quick introduction, and we're going to go around the table.
And good morning, good afternoon, everybody. It's a pleasure to be here, and thank you so much for the invitation. I'm really thrilled to be in this discussion. This is so exciting. So I'm responsible of patient experience in Japan at Johnson & Johnson, but I'm also a co-leader of our Smart Healthy Aging Initiative, which is an initiative that we started in Japan to really extend the healthy life expectancy and improve the quality of life of the elderly population. So you probably already know that the Japanese population is enjoying one of the longest life expectancy in the world, with more than 81 years old for men, more than 87 years old for women. And you know as well that we have done incredible progress in extending the life expectancy overall in the world within the last centuries, thanks to all the technologies and innovation that we had in medicine and public health. But we really didn't do many progress into, narrowing the gap that exists between healthy life and life expectancy. So it remains like this 10 years gap, which we call the lost decade, which are basically the last 10 years that people spend on their life, and they're generally spent in unhealthy conditions and with lower quality of life. So this is something that is incredibly important to narrow this gap, and extend the healthy life is incredibly important, not only for the individuals, but also for the society. So with the Smart Healthy Aging, we are trying to address this. We are establishing partnership with other industry, with local government, with institutions, hospitals, to partner together and to create innovation that can address that gap.
Great. Paula, thank you very much. Over to Shalya, and just remind you of 2 minutes to just do a quick introduction.
I would remember that. Good morning from the Netherlands, and a warm greetings to everyone joining from Japan and across the world. I'm Dr. Shalya Anand, a clinician, researcher, and a health economist working at the intersection of oral health, healthy aging, and health literacy. For over 3 decades, my work has explored how oral health, often overlooked, reflects overall well-being, and particularly in older adults. Healthy aging is not just about adding years to life. It's about adding vitality, connection, and dignity to those years. And it's invisible, but it is tied to these outcomes, influencing nutrition, speech, and social interaction, and self-esteem. My research connects behavioral and economic sciences with policy innovation, reframing aging as a space for opportunity rather than a burden. At Max Planck Institute, as a researcher, we are developing dental boosts, behavioral interventions to strengthen oral health, while in India, I lead the Smile Age Initiative, a program that integrates AI-driven screening, preventive care, and digital inclusion for older adults. In this, what I'm trying to do is, through community-based networks and non-dental caregivers, we extend access to oral care while generating population-level data for predictive modeling. And as a health economist, I view preventive oral health not just as a cost, but as a long-term investment that builds health span and efficiency in healthcare systems.
Thank you very much. Hiromi, please introduce yourself.
Yes. Ladies and gentlemen, good afternoon. I'm Hiromi Komuro, VC President of the Japan Metaverse Association and the Chairman of the IEEE Digital Transformation Association Japan. I'm honored to be here today. Thank you so much. We can join the Japan and the Medicine Global conference. Metaverse Association, we are do some the AI and the digital twin and MR, XR, VR. Like this technology, we are do some the more product and also make some the project is other do some the detail and can help the economic some the project. So this time we can talking the AI make some of the product give the medical and also give some of the elderly and aging the more the AI can collaboration can do some of the technology to each other can make this new value. Thank you so much.
Great. And Masato, if you can round us out.
Sure. Ladies and gentlemen, hello from Tokyo. My name is Masato Marumo. I run a startup called AI6. What we do is we use Wi-Fi sensing as a new technology to create a 24/7 totally private aging in place solution. And what we are trying to do here is to not only detect some urgent situations such as falls and stop breathing, but also having interactive intervention to the elderly, as well as providing some predictive solution for failure, which leads to prevention of dementia, which is driving a lot of social cost, as you well know. It is quite a new challenge. We're still at a seed stage, but some of the early prototypes are showing promising results. So we are trying to bring this to the market in next 3 to 6 months.
And Masato, can you just touch quickly on just leading on from what Paula started to describe for us, just what is the environment in terms of Japan and healthy aging and longevity, very well respected globally as a leader. Can you just set the stage for us?
Sure. So as you all know, Japan stands at the forefront of global demographic change. Nearly 30% of our citizens are age 65 or older. And by 2035, 1 in 3 will be seniors. And this is transforming nation's economy, healthcare, and communities in a big way. And as Paula says, while the life expectancy continues to rise, the gap, the 10-year gap, the last decade, is becoming one of the most critical, urgent national priorities. And in addition to that, beyond medical costs, a hidden burden of presenteeism is the productivity loss and millions have to balance work and caregiving is eroding the economic activity in a big time. So yet Japan is not merely a social society under pressure. It is a living lab, if you will, for longevity innovation. As the world's first super age nation, Japan has the opportunity and the responsibility to pioneer solutions for aging societies elsewhere. Achieving these
Right.
demands is unprecedented collaboration among government, corporations, startups, and investors. And I think that's what this panel is all about.
Fantastic. Thank you so much for that. Okay, so we're going to go right into the crux of really what we're trying to drive home today. We're going to talk about it in two areas. It's all about how do we build effective partnerships, both with strategics, as well as drive investment. Of course, ultimately, research isn't helpful unless it actually is commercialized. And that's really what this panel is all about. So on the partnership side, just a couple of points before we turn it over to Paolo and the rest of the panel here. As we know, and as all the panelists have referred, we are at a critical juncture in terms of aging, health span, i.e., the quality of our health, and longevity. The way to go is to eliminate these innovation silos globally, start working closely together, and that will lead to not only better outcomes, but more efficient outcomes, cheaper, and in a much more timely way. And so that's why we're really trying to drive these partnerships. We are trying to also get rid of a lot of the noise out there and get really down to the science. So companies that are globally integrating with partners are going to be the ones that succeed and are able to leverage the resources, the data sets, and the like, and the resources across jurisdictions. Of course, there's going to be constraints. There's constraints with regards to operating environments, regulatory environments, etc., bureaucracy, but the benefits way exceed any costs. Also, it's going to provide companies and innovators with better access to data, larger data sets, and much more diverse data sets. And so with that, I'm just going to turn it over to Paula, who will go into a lot more detail around corporate partnerships using Johnson & Johnson as an example.
Yeah, thank you, Lisa. I think what you said really is important because partnership is the core, strategy for addressing healthy aging. Healthy aging is such a, a complex challenge. There are so many contributors. If you think about how can we achieve healthy aging, definitely there is like, a physical health component, a mental health component, but also we need to think about, caring for the aging population. We also need to think about, creating the spaces, the environment that allow the independence of the elderly population. We need to think about, financial stability. We need to think about, many, many things. So addressing all these things is something that nobody can do independently. So definitely, I think partnership is the key strategy there. And actually what we envision is to create an ecosystem of partnership, an ecosystem of different partnerships that can address all the different unmet needs of the elderly population. And in that way, we generate innovation at the same time. So every time that we tackle a different challenge, of course, that's an opportunity for creating innovation. We have seen it with COVID. I think, healthy aging is also, a big challenge and a big opportunity at the same time. So what we are doing, how we are starting J&J with the Smart Healthy Aging is to start establishing, as I mentioned before, partnership with, the government, with other industry, with academia, with hospitals. And the way that we use this partnership is to really drive innovation catalyst programs for healthy aging. So there are, I would say, 3 key areas that we are focusing those catalyst programs. One, I would say, is around generating insights through data analytics, through clinical observations. So those insights, what I mean with generating insights is, for example, uncovering what are the elderly health issues, the multimorbidity challenges. Because when you think about the elderly population, we know that 50% of the Japanese elderly population, they have at least 4 or more chronic health disease. So you cannot really approach their health at the same level as just at the single disease challenge. So you need to look into the holistic approach and think about, holistically, what are the challenges for them in their situations. So understanding what are their challenges, understanding what are the drivers for disease prevention, the drivers for early diagnosis, for optimizing the intervention for this population is also very important. So we generate all these insights and we translate those into key needs. And then those key needs are feeding back into our R&D, but also are feeding back into our strategies at every time of our life cycle.
Great. Wow. Wow. I wish we had more time. And please remember that we are going to have Q&A coming up for all of these amazing experts. So please have your questions ready. So moving on to Hiromi.
Yes.
AI is just revolutionizing precision medicine and preventative healthcare. Not only are we getting to potential solutions faster, but the caliber and the quality of clinical trials and outputs has been accelerated. Can you touch a little bit around what you're doing in the AI and tech space, specifically as it relates to knowledge transfer and building partnerships with Japanese companies?
Thank you so much. So yes, Japan have a lot of the older people and the grow up. So we are association make some of the AI who can give the somebody take the different value. AI can plus make the different product, can give the some the people can the emotion and can take care also the and take care somebody. So another and digital twins like the data. Japan also make the bigger data center. The data center maybe after can join different the data from the physical examination and the center and the hospital and the nurse, the home, and the data center. This data can make a different value. Data answer is using from the research in the different fields to carry value. Data also provide to medicine research and development. So how can using the data and it's not only the one company can do it, one center can do it. We eat the ecosystem. So also different partnership can join to each other, can take the data, make the different parts, can give somebody is a different product, also can make the different value. Also, Japan government have the make the data center, also the university and some of the hospital and different company can join to each other, can take this data, can make some of the different new product and give somebody can help the somebody and to make the something. No, and we are actually make the one AI look at this AI can talking and